there, STEM enthusiasts! Welcome back to Cameron's Lab, Dive In, the go-to podcast for STEM students, crafted with passion by one of your own. I'm Cameron, your enthusiastic and ever-curious host. Buckle up for today's insightful episode. Ready to dive in?
We are live. Hello, everyone that we can see coming in. It's lovely to see you all. So I'll just wait for a few more people to come in, and then I will get started. So we've got lots and lots of attendees coming in this afternoon, which is lovely to see. As soon as the number stabilizes a little bit, I will kick off. Okay, that number seems to have settled, so I will formally start the webinar. Hello, everyone, and a warm welcome to our AI in Healthcare talk, part of Queen Mary's Breakthroughs in AI series. My name is Holly, and I am one of the marketing managers in the Faculty of Science and Engineering here at Queen Mary. I'm delighted to be here with you today, joined by two celebrated academics from different parts of our faculty, and I'm also joined by our host, biomedical engineering final year student Cameron, who will be leading today's discussion about how AI is being used to transform the diagnosis and treatment of health issues and what the future could hold for these technologies. So before we get started, I'll quickly run over some housekeeping information. We will be with you for between 45 minutes to an hour today, depending on how many questions you will have. If any questions spring to mind while the talk is ongoing, please use the Q&A tool and we will respond to your questions during the Q&A portion at the end. We will try to answer as many of your questions as possible during the course of today's talk. Please note that the talk is also being recorded to be viewed on demand by yourselves and also future viewers. You'll be sent this recording by email should you want to access it again. I'm done with my bit, so I will now hand over to our official student host and budding AI expert, Cameron, to start today's talk.
Good morning, everyone. Thank you, Holly, for that wonderful introduction. Well, I should say good afternoon now. So today I'm really excited to be joined by Dr. Caroline Roney and also Dr. Mohamed Elbadawi. So please allow me to introduce myself briefly. As I mentioned, my name is Cameron Young, currently in my last year of studying biomedical engineering. I was invited today because of my passion for AI, and I have a podcast called Cameron's Lab, which is where I've had the opportunity to interview other academics such as Dr. Mohamed and Dr. Caroline. So I'm very excited to bring that into today. So allow me to introduce our guests. I'll start off with you, Dr. Caroline. So Dr. Caroline is a reader in computational medicine in UKRI and in computational medicine and a UKRI Future Leaders Fellow. Her research combines signal and image processing for machine learning and computational modeling techniques to develop novel techniques for investigating cardiac arrhythmia mechanisms from clinical imaging data and electrical recordings. These tools aim to predict optimal patient treatment specifics in the clinic. Her work highlights interdisciplinary nature of healthcare, blending mathematics, engineering, and medical science, which all of us must find really exciting. And Dr. Mohamed, he is recognized as a top 2% scientist by Stanford University, consecutively both in 2022 and 2023, and focusing on the practical applications of digital technologies in healthcare. His expertise in machine learning, robotics, 3D printing points to the diverse ways that AI is being employed in the healthcare industry. From predictive analytics to robotic surgeries and personalized medicine, his work exemplifies the innovation that AI brings to healthcare. I'm really excited to have both of you today. Thank you for joining me.
Thank you, Cameron. Absolutely pleasure to be here.
Thank you. So Dr. Caroline, I wanted to start off with a little bit of your research. So I wanted to ask, for example, the digital twins that your research has. Could you briefly explain what that is? That it sounds a little bit like something out of a sci-fi movie, and also how you're being able to implement them with machine learning techniques to improve the efficiency of making those.
Great. Yeah, thanks. Thanks so much for the opportunity to be here today as well, and for the great introduction. So what do we mean by digital twins? So we mean it's a virtual representation. It could be of a cell, it could be of a tissue, of an organ, or it could even be the whole body. But the key points that we have are that it should be personalized to the patient. So, for example, if we wanted a digital twin of someone's heart, then we'd need some imaging data, and we might need, say, an ECG data, some ECG data on their electrical signals, and then we personalize the model to the patient. And if later we have new data on the patient, so for example, if we have data from a wearable like an Apple Watch or a Fitbit, then we can update the computer model with that new data and then make predictions. And we also have the coupling that if we make a prediction with our digital twin or our model, we'd then like to be able to say, okay, to the patient, you should change your treatment in this way based on the digital twin, or you should consider changing your lifestyle in this way based on the results of the simulations from the digital twin. So essentially it's a fancy computer model personalized to a patient. And in terms of like how we use machine learning for this, so going from a large amount of medical imaging data and ECG data through to a finite element like computational model takes a very long time to make the models. So what we do is, for example, we might use machine learning or AI to automate the segmentation. So that means if you have an MRI or a CT and you need to say where in the images you have the different chambers of the heart, we essentially train a network to predict that segmentation so that we don't have to manually do that. And that saves a lot of time in terms of building the models. And the same with like personalizing the models. When we're working out what parameters we need in our models, we can use machine learning to make that much faster.
And so speaking of making personalized approaches, so I mentioned before that your research is focused on, for example, cardiac arrhythmias. And I do remember, for those who don't know, Dr. Caroline, I had this privilege of her being my professor for a short period of time where you introduced this to us, so that was pretty exciting. So I wanted to know, in terms of like personalization, because of how that, I guess the disease would be different from person to person, does using things like digital twins make it a lot, I guess, suppose easier for you to be able to make it more personalized in that way?
Yeah, definitely. So I guess a lot of the time, when we're thinking about treatments is often what works for the average patient, or even in a clinical trial, people will be grouped into different groups and then compare different treatments. But you often just say broadly based on someone's treatment, based on someone's properties and some basic features, do we think a treatment will work or not? But actually, like, as we know, we're all very different. We have different genetics, different lots of differences in terms of the shape of our heart and the size and the electrical properties, the scar tissue. And so if we can bring all of that into a digital twin, then we can make predictions that are much more personalized to an individual. And it's challenging for a clinician to do that because essentially there's so much data, and a lot of times it's not necessarily known how all of the different features will affect a person's likely outcome with the different treatments. So the digital twin helps us to bridge that gap essentially.
And thank you for mentioning that difficulty that clinicians have to make it personalized for each patient, because I was going to ask you, Dr. Mohamed, if you wouldn't mind explaining in your own research for drug delivery, how are you able to make sure that they are, I guess, personalized to each patient in that way? And then how does 3D printing come into that as well?
Sure. Yeah, that's a really good question. Of course, the next frontier in medicine is personalized medicine, but it's also precision medicine. How can we precisely make therapeutics tailored to the individual? 3D printing is what we refer to as a digitalized fabrication technology. If you told the 3D printer to move by 0.5 millimeter, it will do exactly that. If you told my hand to move by 0.5 millimeter, I don't think it will do that. Even, I played a lot of sports and whatnot. But yeah, essentially, it's a lot more precise than what a human person can do. Currently, now medicines are being made by hand in hospitals or in pharmacies, and it's just not precise. It's humans were good for many things, but our precision isn't quite there. Definitely not at the same level as say AI or 3D printing. So yeah, 3D printing allows us to precisely develop the medicine. And then AI is helping us to compute all the amount of data, because when it comes to making a medicine, there's a reason why it takes 10 to 15 years for that to happen. So many factors to consider, and then AI is doing that for us at a much faster pace than what we can do as humans.
Definitely. And then I think one of the papers that you mentioned before was AI generates 3D printing formulation. And they mentioned that human ingenuity is crucial, but as you mentioned, sometimes humans can make a little bit of mistakes as well. So how are you able to, I guess, balance that need for human ingenuity and creativity when you're bringing in these AI models?
So yeah, I guess if we're in research, we're very curious individuals. We like to really push the frontiers of science. But sometimes it can be there's a lot of fatigue, and then it takes a lot of time to generate new ideas, especially for solving, for solving natural problems, for solving medical problems. It requires a lot of ingenuity. And yeah, recently we've started asking if AI can figure out and be creative and come up with solutions for treating these. So in that recent paper that you mentioned, we just asked it to see if it can come up with its own medicine formulation, and then it turns out it did. And rather than just leaving it as a theoretical paper, we decided to test it and see if the medicine can actually be physically produced, and it turned out that it can. So yeah, that's it in a nutshell. I think we take it for granted. Mark Zuckerberg, I think Barack Obama, in order to prevent decision fatigue, they used to wear the same thing day out and day in, and then just leave the decision making for the real things. And if AI can do that for us, then it can hopefully open up new avenues for the medical sector.
I agree. And I want to bring it back to you, Dr. Caroline, for your research, as you mentioned, there's this need for making it more personalized, which is, I think, the kind of like a theme for using AI in healthcare to be able to make it more personalized and easier for people to have access. How would you, I guess, deal with the privacy side of that? So, for example, when you have all of these different models from your different patients, how are you able to, I guess, maintain that level of privacy? Do people trust it more because they know it's their own data? What have you experienced so far with that?
Yeah, so I guess a lot of the time, yeah, so it's very important that first of all that data's anonymized if it's being used in a research study, or at least pseudo-anonymized. And what pseudo-anonymized means is that there is a list that will link back to a patient, but we wouldn't have it on the engineering side. It would just kind of be kept in the hospital. But essentially the data has to be anonymized so that in the imaging data we don't have any of the patient characteristics and anything that could link it back to the patient. And if we have to keep things in mind, like if someone does have a very a rare disease with like kind of a low prevalence or something that could really mean that you could identify that person, then that case would need to be excluded from a study, for example, so that you can't get back to so that it's very challenging to go back to the original patients. But another way of getting around kind of dealing with the issues of privacy is using synthetic data. So what you can do there is we might originally, for example, have lots of heart anatomies, and we'd then make a statistical shape model based on all of the anatomies and then make different anatomies from that. So essentially the different models of virtual patients aren't, and they don't represent any real patient. They've come from a synthetic approach, and synthetic data and AI is being used a lot more to get around the challenges of data privacy.
Definitely. I wanted to ask a little bit more, I guess, for the cardiology side of it, for those of us who are a bit more interested in that side. I wanted to ask, how are you able to bring in AI for that side? Because when we're learning about things like cardiology in class, most of the time you see this will all be human-based. You have the machines and everything like that, but then how do you transition to start making that more automated? Are there any challenges you've noticed when you're doing that?
Yeah, so I guess AI is used in a lot of aspects of cardiology and radiology as well. So it can be used, as I was saying, for like automating the segmentation, and it can be used in some cases for automating if you're doing a diagnosis from imaging data. And in that way, it can help a radiologist, or if there aren't necessarily it can do a first screening of the diagnosis, and then it would be checked by a radiologist. So it can kind of be used in that way directly. Or what we're really aiming to do is to use it to test new treatments, to really personalize that to a patient. So for example, with atrial fibrillation, which is an irregular heart rhythm in the top chambers of the heart, we'd like to be able to there's kind of two different ways of treating it, either with antiarrhythmic drugs, or they can apply radio frequency energy to essentially like burn the tissue and stop the electrical wave from propagating. So we're looking at new ways for how you should design where you should ablate the tissue essentially, and using the AI with the physics-based models, I think is kind of where we see the advantages of both, because it captures kind of the physics and the physiology of the patient, but it also runs quickly enough that you can use it in the clinic, and it also learns from all the population data that we have to make better predictions in the patient-specific models. So for us, it's kind of that combination, I guess.
And then if I could take it back to Dr. Mohamed, especially for the pharmacy industry. So like you mentioned, just wanting to have that personalized, wanting to bring it into make it easier for people. So how would you say that AI is really affecting the pharma industry? For example, the pharma industry is huge and it's quite an old one as well. So it must be hard to make changes in such a large industry. How are you finding that your research has been able to be adopted thus far?
Yeah, no, that's a really good question. I think just in the first part of that question, yeah, they're huge. You've got Pfizer's, GSK, they've been around, I think, for the best part of 100 years, maybe more. But AI is really, really impacting the sector. I think the best and most recent example would be Moderna, the guys who brought out the COVID vaccine in 9 months, where typically it takes years to bring out a vaccine, if not a decade to bring out a vaccine. And they've attributed AI helping them to consolidate all this amount of data. I don't think if most people will appreciate, but the pharma sector does generate a lot of data. Even though they produce tiny little tablets, pills, they generate a lot of data. And then if being able to harness it is a gift. Not many people can, but AI certainly can. And yeah, they leveraged it, and the impact of it was, it's been immeasurable. COVID kicked in the Western world, I think about March. By the end of the year, there was a vaccine, and about 6 months later, the world opened up for us as well. So being able to harness AI helped them to achieve all of these immeasurable impacts. My research in particular is focused on, so there's AI is a huge field by itself. There's so many ways. Even if you're a computer scientist, you could probably spend a bachelor's, a master's, and even a PhD, and you still wouldn't have covered nearly half of it. What we're focusing on is using AI and making and utilizing the tools that will help the pharma industry. Techniques that will be able to accelerate research development, techniques that will be able to describe a drug such that a machine can understand it, and at the same time being able to have a 3D printer intelligently operate by itself. Other things are the regulatory sides as well. It's medicines, batch-to-batch variation is quite a key issue. Some batches in say sent out to the US might behave differently to how they're sent here in the UK. So how can we minimize that batch-to-batch variation? So yeah, there's a lot of applications of AI, and then we're particularly focused on what could really help, the pharma industry, especially in the UK, really adopt the AI technologies. I think the US and China are much, much further ahead. So some of the things we're looking at is, we have these small pharma companies in the UK, their revenues in the millions, so it's not in the billions, like some of these big companies. And we're just helping them to try to compete with the big pharma companies.
Thank you. I'm going to move over to Q&A just because we have had quite a few questions in the section. So the first one is actually for you, Dr. Caroline, from Tom, who asked, are digital twins new or has it been around for a long time? And what has changed in recent years?
Yeah, so I'd say, I guess they originally started more as like a concept within engineering. So you might have a digital twin like of a plane, for example, to reduce the amount of tests you'd have to do on a real plane. So you'd have a computer model, and then you'd run simulations there, or like digital twins even of whole like engineering plants. And the idea is that you have a continuous loop between the data that's collected in the environment with the machines or whatever it is you're testing, and then that then feeds into the model, and then you can update both based on your predictions, or you could test lots of different variants of an aeroplane wing and then only have to test a few in real life. So that's kind of where it originally came from. In terms of digital twins in healthcare, we've had like computer models around for a long time. So say like first computer models of cardiac action potentials, or within neuroscience are kind of from the 1950s, 1960s. Kind of it's been advancing from then, but we really used to just call them computer models or patient-specific computer models of organs. It is now more recently that there's this real kind of drive towards the digital twin, and it's kind of a lot more people are talking about it in terms of digital twins. And in healthcare, we sometimes miss the link back in terms of updating the models with new data. So in not all of the time is it a fully coupled system, but we'll often still refer to it as a computer twin, digital twin. But essentially, it's a fancy computer model.
I think the word like digital twin makes it a lot more exciting than a computer.
Yeah, I think so.
So I just want to add a little bit. So Siemens are also using digital twins. So they're using it to basically simulate a factory plant before they commission it. So it's been used in the pharmaceutical industry as well. I think I don't know if Caroline's experienced, but I think it's probably a little bit easier to build a digital twin model around something that's inanimate, like a machine or glass file, and then the stuff that's been applied there can also be translated also to the healthcare sector, and then manufacturing of medicines as well. So we're learning from each other, and I think that's what I've noticed has been a recent change as well.
Thank you. The next question was, many AI companies are making use of neuroscience. Can you tell why that's the case? I'm not sure who would be most suitable for that question.
What was the question, sorry?
Many AI companies are making use of neuroscience. Can you tell why that is the case?
It's a little bit outside my domain, but if it's related to targeting a drug in the CNS and central nervous system, then AI is being used to identify what are the possible druggable receptors or the druggable biological targets there. But it's a little bit outside my domain. I mean, I guess the closest thing I have to neuroscience is 3D printing synthetic neurons.
Wow.
It's not necessarily AI. It's just more synthetic grafts.
That's very cool. I wonder if it means as well, like in terms of some of the deep learning approaches that are coming in for medical imaging data, like the networks are often built. So you'll have like convolutional neural networks where the idea is that they're built based on how they think the brain might learn. So I guess there are kind of those links there, perhaps.
I want to do one of the pharmacy industry questions. Oh, thank you, Holly. Always reminding us that there's another human-led AI webinar next week, Thursday, where you can learn more about that as well. So this was one for more of a pharmacy one. So they were asking, so Victoria says, AI is exciting and clearly very useful for medicine and pharmacy. Yet what would you say the main barriers for wide adoption in the industry are? Thank you.
I think generally, overall, the pharma industry is very slow to adopt these technologies. There's the human side of it, there's the technological side of it. They're very slow to adopt technologies. And Moderna, much younger. I think they're probably about 20 years old, not very old comparatively. So they're young, they're agile, as most young things are, and they just adopted it. But we're seeing a massive change. AstraZeneca about 2 weeks ago put out a summer internship call asking for MSc students and PhD students with machine learning for pharmacy experience to apply. So we know they're changing. Everyone is trying to copy the Moderna format. How can you quickly accelerate and get drugs out there as soon as possible and not spend 10 to 15 years and billions of pounds producing them? So there are challenges, but I think fortunately with AI and with the support of the FDA, so the Food and Drug Administration, as well as the UK's equivalent, the MHRA, they're changing their mindset and then they're reducing those barriers.
And then I really like this question from Tom. His 15-year-old daughter would like to know, isn't it dangerous to leave the decision making to AI? What do we think?
Caroline?
I think at least in my research, we're not trying to replace the doctor in any way. The idea is that the AI is there like as an additional aid but the final decision will always be, at least with the clinician, on how to treat the patient. But they might use that AI to consider different treatment approaches and how likely they are to work. But we're not suggesting to remove it. And I know there've been studies like looking, say, with radiologists where they've compared having a radiologist compared to having AI, compared to having both. And at the moment, some of the studies are showing that actually having the human plus the AI does lead to sometimes worse predictions than either just using the human or using the AI. And that can be because of some of the influences between the two systems. So we really need to think, I think, going forwards of how do we best help use the AI to help the clinician or to help the doctor, and to make those then end up with decisions that are better because we've got both.
Yeah, I think I mean, definitely humans are we're fallible. We do make mistakes. Currently, incorrect prescriptions are costing the NHS about £100 million a year. So there's an issue there, and we're hemorrhaging a lot of money. So we do need new solutions. And as Caroline said, AI is helping us to minimize those errors as well. It's not just the money that's that we're expending, but also we're putting patients' lives at risk as well. And we need new innovative solutions to minimize these societal issues.
Thank you. The next question that they had was actually specifically for Dr. Caroline. Wait, sorry, Dr. Mohamed for this first because I found it a little bit sooner. So Dr. Mohamed, in 3D printing, do we have any materials which can print autoclavable materials, just in case we want to print a customized jig that needs to be used in patient's mouth, for example?
Yes, definitely. We have commercial. There's, there's many people looking into this, and so there are companies producing readily made or readily available autoclavable materials. And at the same time, we can also make them in the lab. Try to create some new innovations as well, as opposed to just necessarily using these off the shelf. Yeah, in short answer, yes, there are.
Thank you. This one was for Dr. Caroline, apparently. I couldn't find it in time. But it's from Kanwal, who is an orthodontist interested in applications of AI. So he would like to know, Dr. Caroline, could your digital twin model be used for craniofacial region and predict effects of orthodontic treatment? For example, extraction of teeth. What would you?
Yeah. I mean, maybe this is, I guess, where we could combine kind of maybe my research and Mohamed's research too. Like, I think you could, I mean, anything that you can image and you can make a mesh of, you can make a computer model of. So you could definitely, if you could do some imaging of the teeth, then you could make a computer model, and you could look at finite element simulations to look at stresses and strains on the teeth, for example, with different changes. And you could update them over time based on some measurements that you get. So there are some finite element models that look at teeth and different types of braces or to see essentially forces, stresses and strains that you'd have on the teeth. I don't know too much more about it though, so sorry about that.
I mean, I for that research. If you can quickly get in and get out of dentists' surgery, then that would be great. If they can run all the simulations behind the scene, minimize the amount of pain they cause you, I think that would be a dream. That would be a really, really good dream.
Totally agree. It sounds like a lot, like I think what the main thing for AI is just a lot of having the data. So if you have the images, you have the data, it really does make a huge difference when you're trying to get these models to work properly. So I wanted to ask a little bit more from Amtwal, who asked Dr. Caroline, are digital twins involved in heart transplants as well?
Yes, you could. I don't know too much if they've been used in heart transplants. I think they've been used in terms of like looking more at, say, congenital cases where you have lots of differences in the anatomy, where having a computer model of it can help essentially planning the treatment. I don't know specifically about heart transplants or not, but that could be a really cool area to look at.
Maybe. This one's a little bit more related to just QM and the courses that we offer, so I'm sure either of you could answer this one, but it's just wondering what projects are available in the university around AI in healthcare.
I'd say there's now a really cool like Centre for Undergraduate Research being led, I think it's by Dr. Giuseppe Viola, I think, and he is essentially pairs up undergraduate students with different labs across the university, and the idea is that you can get involved even from the first year of your degree and throughout. So you might even be in the same lab for 3 or 4 years, and when you have gaps kind of between lectures, then you can help out a bit. So we have 2 students at the moment who are here on that scheme. One of them, Kian, she's looking at using machine learning, so physics informed neural networks is like combining physics and machine learning for looking at modeling cardiac electrical activity. So yeah, she just comes in when she's got gaps between lectures and is really enjoying it. So I think that's a great way to get involved. It's not officially one of the courses, but it's outside of the degree.
Right. I guess I wanted to ask a little bit more, I guess, for the impact on more of a global healthcare scale. So with the use of AI, it's like you mentioned, helping with automating things, making it more personalized. But how would you talk to us about, I suppose, getting access to those materials? So I know that, for example, Dr. Mohammed mentioned that with the NHS, we're losing quite a bit of money in terms of when we aren't able to predict things properly. So for those countries that may not have access to all the resource and data that we do, how do you, I guess, how does your, maybe not if your personal research, but how does the research with AI transform over to those other countries, if you have any insights on that?
I could probably take a stab at it. It's definitely that's a really, really good question. I mean, part of the reason why we're doing this is to make it as open and accessible and really to just improve, to improve the lives of patients. I guess there was a research that we conducted last summer where we used these speech recognition models, which are powered by AI at the end of the day, and we applied them here in the South London community, and then we found out that about 80% of the patients, let me rephrase that, 20% of the patients couldn't even say paracetamol, and the AI recognition models, speech recognition models, was detecting all kinds of different words. So they're powerful, they've been applied, but for some reason they are neglecting some of the more deprived individuals. So I'm from South London as well, so this is why it interests me. So I think the thing that we need to do is have more people interested and start implementing AI in these, in third world countries and other deprived areas. And from doing that, we'll be able to find out what are the gaps, and then we can try to address them afterwards. I don't know if Caroline.
Yeah, I think it's such a key point. The bias in the models, like, is essentially if a population of people are not very well represented in the training data for the model, so if it hasn't seen people from different socioeconomic backgrounds, or perhaps depending on ethnicity or age or sex or anything, then it won't necessarily make as good predictions for those people that it would for people who've seen lots of training data for. And I think in terms of healthcare, they've shown that, I think it was some of the predictions, I think for diabetic problems with the eye, like it worked better on people with lighter skin than darker skin, for example. When they looked at some of the predictions of segmentation from UK Biobank data, the segmentation accuracy was worse for Black people than white people, and it's often because you don't have that data in the training data set. And we really need to be thinking about how do we make sure that everyone has access, first, everyone has access to these tools, but also that the data is as balanced as we can make it. And that there are ways to account for it in the AI. But in the end, like, yeah, we really want everyone to be able to access the same types of imaging, the same types of AI. We don't want to end up where we have different systems because some people have more access to AI than others. And it's really, really challenging though.
Just want to add on to that as well. I think the issue we have is that it's not enough AI practitioners. We know these problems exist, and it's probably why Queen Mary and other universities have also started offering these courses. The idea is to start training more people, get more practitioners, and then they can go solve these problems. Yeah, it's a really good thought. I like the question.
I wanted to ask a little bit more. I suppose there was one question in here that asked about the AI being applied to public health programs. I suppose that does piggyback off of what you both mentioned of needing this more people to actually practice it, but also more people to, I suppose, provide that data so that we're not missing any gaps. So if you could talk more about it from a public health perspective as well.
I mean, briefly, I mean, there's plenty of public health data. I've worked with individuals who work for the Public Health England. There's plenty of data that they're using simple analytical, simple mathematical models. So there's huge opportunities. But yeah, as I said, there's just not enough of us to start, spreading ourselves, taking care of pharmacy, like Caroline, taking care of cardio surgery, and at the same time helping the public health sector. But there's opportunities. There's definitely, but there's plenty of data as well. I think that's the key thing.
Yeah, I think so. And just making sure as well, like whenever we do our research, we really try and focus on like involving patients, involving the public, so that we can see like why people would or wouldn't want to be involved in a research study. So if it's a study with digital twins, like if you don't know what a digital twin is, you probably don't want to be involved in the study. And it's all of those things that making sure that we can access access all populations that want to be involved in research as well. And it's really about education, and that side I think is important. But
And then from another perspective, I wanted to ask, I think Dr. Mohamed, you already mentioned how the pharmacy industry is beginning to integrate your research, but how would you say that healthcare professionals perceive and adapt to the incorporation of AI tools in their daily practice? Are they more welcoming to it, or like you said, Dr. Karen, like they don't know what it is, they don't want to integrate it? So how would I say that for either of you, really, are people integrating these tools? Are they more for it or against it? What have you noticed so far?
I mean, for me personally, I've noticed many of them are for it, especially the younger clinicians. They're looking at how the NHS is being operated, and they don't like the wastefulness of it. And so I'm always approached by my clinician friends. Oh, could AI do this? Could it help me with my medical writing? Could it predict if a patient is likely to come to the MRI surgery, MRI appointment or not? So some are absolutely up for it. I think it's just one of these things where the regulatory body and then the NHS can be slow moving. But I think when they see that the pharmaceutical industry is adopting it, maybe they'll be a bit more inclined. Having said that, I should give credit to the NHS actually. They've got the NHS Digital, they've got the NHS X, so they are looking into it behind the scenes. So hopefully, once critical mass is reached, hopefully things will start changing.
Yeah, I think that I've had the same kind of experiences. Like, we work a lot with clinicians, and we have lots of collaborators, and they're all very, very positive. And I think it's very key for us, like on the engineering side, to make sure that we always have that clinical input, so that we know that we're answering the right clinical questions, so that we're not. We can make really fancy computer models to look at things that are not relevant, for example. And just, I think all kind of research needs to be kind of having that co-creation, means that hopefully we end up with the tools that are most impactful, and that it does help us as well to gain trust. But yeah. I think generally we have very positive collaborations with Bart's Hospital and other hospitals. So yeah, it's great.
Definitely. I think in my own classes we did like a little bit of going to one of the hospitals. So the Queen Mary is very useful for that. Being able to go into the hospital and learn a little bit more. Second year, if you do biomedical engineering.
Yeah.
So I wanted to take it back to the digital twin, since we did just mention it. Is there any current research on fully automating surgeries or other interventions using digital twin models? Nurul would like to know.
I'd say for planning, yes. There's, I guess, quite cool areas of robotics, where they're looking at kind of using a bit more robotics to control the catheters. I don't know if I guess it is kind of a digital twin, but that would be more in kind of the robotics side. So yeah, there's very, very cool robotics research as well at Queen Mary. There's the Advanced Robotics Centre. There's very cool research in kind of in loads of different things. So like in endoscopes and having automated cameras, or in controlling catheters with robotics. So I'd say those areas are probably more towards automating the surgery. Yeah.
Thank you. Thank you for bringing up the robotics as well, because I did want to ask Dr. Mohamed a little bit more about his own robotics research. I think one of the recentish papers that I saw was on biomimetics in healthcare. So if you wouldn't mind talking a little bit about that, and maybe if you bring AI into that at all, we talk about that.
Sure. Yeah, I think it's, AI is all virtual for the majority of it, and the robotics are more on the physical side. So if AI can make the decisions, then we need somebody to actuate it, somebody to actually act, and that's where the 3D printing and the robots have come in. I spent 2 years in Sweden. I was working with the robotics team over there. They build robots for climbing up walls, cleaning windows, cleaning the underside of aeroplanes and all of that. And we just started to have discussions and start finding out how we can begin to implement them in healthcare. So last year we ran a project. We had a robotic arm. One of the issues that we've seen in healthcare is it's quite difficult to I wouldn't say it's quite difficult, but it's quite wasteful to produce to apply wound dressings. So yeah, last year we had a project. We had a robot kitted turned into a 3D printer, so then it can apply the wound dressing onto the patient directly. We didn't use a real patient; we used a prosthetic arm. And at the same time, we had somebody build an AI machine vision algorithm behind the scene to help the robot, so it can be anywhere, oriented, looking in any direction. I should say robot arm, not entire robot. This is just a robotic arm equipped with a camera. We would put the arm in all kinds of orientation, and then let it by itself figure out where the wound is, and then afterwards start 3D printing on top of it. So yeah, this is an example of how you can use AI to make decisions and identify, segment, look for the target, and then the robotic arm to actually actuate it and actually perform the action. And then hopefully in the future, maybe extend it from a robotic arm into an entire robot. But again, we need more practitioners and we need more people, and more human resources.
Exactly. Yeah. I think that does kind of lead into a little bit more of like what people have said in terms of AI. You've probably already heard it, but like when you're doing AI, people are going to lose their jobs. But I think what you guys have been mentioning so far is that there's actually creating a need as well for more people to be working in AI to get on the research, and not just on the computer side. So Dr. Mohamed, you mentioned more of a physical side with the robotics. So could you talk more about that in terms of like how your own research has probably opened up more opportunities in this space as well?
Yeah, I mean, the only reason why I got into AI is because there's so many challenges. And then again, I've only got two hands. So AI is helping me to tackle some of these challenges simultaneously. As I'm talking to you now, I have a code running for looking for, I think I can say it, for new cannabinoid drug target potentials. So I'm sitting here and the code is running in the background. So I'm able to do multiple things. In terms of losing jobs, I can understand it. I mean, it's not my intention, but by all means, I don't think it's anyone's intention. But society has been through this many, many times. When the photocopier came, a lot of secretaries lost their jobs. Similarly, when computers were invented, I guess a lot of people who used to database entries lost their jobs as well. But this is something, I guess, beyond research. I guess we need policymakers and governmental input to help train people and help them find new ways of being impactful in society as well. So I wouldn't worry too much about it. I think no one's going to leave you stranded, definitely.
Yeah, we really need all the human innovation as well, as you were saying, like the new research directions, or how to, what to do with the AI, how to use it, and it just means we can accomplish more, I think.
Yeah. And then for the students that are coming up into this AI space with all the new AI robots and everything, how did you say that future students that are studying healthcare topics are being, like, how are their studies changing with the aid of AI? This was from Zara, who asked the question earlier.
I guess do you mean in terms of, yeah,
Right,
I think I don't know, because I think it's probably helping people to study, to do things more quickly, to get a starting point. I guess in terms of coding, like people would previously you'd use perhaps use Stack Overflow to get a starting point with your code. People are now using ChatGPT to get a starting point with their code. And it just means that if you've got that understanding as well, I guess you can do things more quickly. And I think you'll see like AI has so many really cool applications in the medical field. So if it's improving diagnosis or analyzing, as we say, large imaging data sets or combining it with robotics, there's just so many cool areas that is being applied. So having that understanding and knowing how to apply it will just opens up so many different areas, I'd say.
Definitely.
Well put.
And I wanted to ask a little bit more. Somebody else's question was, this was an anonymous one, but what are your thoughts on integrating a doctor into an AI model so that that whenever a patient searches on the AI platform, they receive real-time medical advice and a disease diagnosis from a qualified professional? I think you touched on that briefly before, but I think if you could just explain a little bit deeper.
Yeah, I guess one thing like we have to remember is we were kind of spoke to some of our clinical collaborators about it, and they were saying like about the importance as well of like the clinicians kind of obviously their interaction with the patient. We definitely don't want to lose that because they have like the clinicians touch, like they're kind of there's lots of nuanced kind of decisions and understanding, and I guess it can help if you have something that's automated and gives some initial guidance, but we'll always need the clinician, I think, to bring that together and to communicate that and to communicate all those differences. I think but it can be a good starting point.
Dr. Mohamed, did you have anything to add to that side, maybe?
So the question was it putting AI into?
Yes. Actually, sorry, I'm going to change my question actually, because
Okay.
in one of the previous papers, well, sorry, your most recent paper, I would say, for AI generates 3D novel 3D printing formulations. Just in the abstract itself, you had mentioned how human ingenuity is so required, especially in that, like you mentioned, for the physical side of it, so you can keep track to see what's happening. Obviously, we make little mistakes, but bringing in that human ingenuity is so important. Could you talk about how a little like go into a little bit more depth of how I guess AI is able to not only assist, but I suppose like really be that second helping hand that you have when you're doing your own research, especially for the drug delivery side. So if we can talk a little bit more about how you're able to integrate in that way.
Yeah, so I have different research avenues. One of the things is this 3D printing medicines, again, for the interest of precision medicine. I've got other, working on natural products as well. So I've got many, many different research avenues, and it's just quite hard to switch my mind from when I'm working with a 3D printer to working with a robotic arm. So again, trying to achieve multiple things for the interest of, improving society. And I can't clone myself. I don't think there's any technology at the moment that will allow me to physically clone myself. So I'm looking for AI to essentially clone myself and clone my team as well. And then it's getting there. We're not doing anything, that's kind of reinventing the entire wheel, where we're looking at how AI is being applied in other domains and then repurposing it for the pharmaceutical sector as well. And so far it's working very good. We're getting positive response, where we're getting, pharma companies asking us, could you do this? Could you do that? Our governments are on the back of us for CO2 emissions. Could you please help us build a model that can help us to reduce our CO2 emissions and so forth. But yeah, we're only at the cusp. We're only at the beginning. So there's a lot to be done. And I hate to sound like a broken record, but we do need more people and more human resources.
To try to just piggyback off of that a little bit more. So you already mentioned like the future and how everyone's starting to become very interested in AI and how it can be used. And so for global health tech industry, I believe it's valued to be about $549 billion by the 2028. Have you all noticed any emerging technologies in terms of trends, such as AI, that you've noticed and that you think might contribute to this in your own research, or for example, in the carbon side, like you mentioned, Dr. Mohamed, but mostly healthcare? If you could take that side.
So yeah, I mean, there's many things. I guess so AI in the pharma industry for the most part is just a tool. It's accelerating these developments. we have a clinical condition, we have a clinical need. How can we quickly develop a drug and a therapeutic? And what people are finding out is AI can reduce that time, as Moderna have demonstrated. 9 months to get. I'm not a spokesperson for Moderna. I don't work with them at all. But I'm still shocked that they managed to pull it off in 9 months. And it's the same. I don't want to sound morbid, but who knows what other planetary or human threat is around the corner. So we want to be prepared, and that's what AI is helping us to achieve. But there's also enabling technologies. I think, Apple now are bringing out these M1 chips, M2 chips, M3 chips that are making it accessible for people to build models just on a laptop, small scale models. But yeah, I think again, just lastly, before I pass on to Caroline, in the AI drug discovery and AI drug development sector, we're finding startup companies are establishing themselves and really pushing the envelope and pushing the research frontiers as well. So they're driving the market as well, and the pharma companies are looking to see what they're doing and acquiring them when needed. But yeah, there's many factors, and half a billion it just suggests that there's a lot of potential and a lot of jobs are going to be incorporated and implemented.
Yeah, that's really, really cool. Yeah, I think, just saying like digital health as well. Like there's lots of apps coming out now. You can look at characterizing your movement or your gait, or looking at your, like all these healthcare apps that are being developed by different startups and different digital health companies that mean we can really kind of focus as well on early intervention, so helping people as soon as possible, making different lifestyle choices and improving outcomes that way, so that people will have healthier lifestyles and then there's less burden on the NHS later. I think there's lots of really cool areas where AI can help there as well.
I want to take it back to the Q&A section. So somebody named Conwell has asked for Dr. Caroline, I believe, how much of your digital twins predicted changes in treatment and how was their accuracy? And then also, like, if you could describe any experience that you've had while using them, especially if you've used them in real life patients.
Yeah, so we're still looking a lot with retrospective data. So that's people that have already been through the hospital, and we're analysing their data and trying to mechanistically understand their type of arrhythmia. We're not yet at the stage where we're using it in the clinic, but that's what we're trying to do next. So we're really excited about that. But at the moment, we're testing them. And what we're finding is that when we add our finite element simulations and use machine learning or AI with like imaging data and the patient history data, we see an improvement in the prediction than if we don't use the physics-based simulations. So the combined approach does seem to be improving our ability to predict. So we're really excited about that, but we're now doing more validation and doing more work on quantifying the amount of uncertainty we have. So there's lots of uncertainties in the data that we bring into the models and seeing how that then affects our predictions. So we're doing lots of development work there, and then hopefully then get it into the clinic. So
yeah, very exciting. I think just because we are just a tiny bit low on time, so I'm just going to try to summarize the last few questions. There were quite a few that wanted to be more specific in terms of like the courses and things that we're looking at with Queen Mary. So I was wondering if both of you would be able to give, I guess, a little bit of a highlight of your own research here at Queen Mary and what kind of courses you think, like, where people might be able to see you or learn a little bit more from your own research and how they could get involved in that way.
So
Sure.
yeah, sorry, do you want to go
please.
first? No.
I can try to keep it brief. So we run an MSc course in AI for the biosciences. It combines quite a broad aspect of biosciences. In the first semester, they cover genomics, they cover cheminformatics, ways of representing the physical world in such a way that the machines can understand them. Second semester, they come to me and then my colleagues as well. Then we teach them. I focus more on the fundamentals of AI, but also how to build the model, for example, to predict drug biological targets. So they cover that, and then in the summer they work on a project. They start applying and exercising all of the knowledge that they've learned. We have projects. Again, the projects are research led. I do get the students involved in some industry led projects. If a company says to me, "Can you build a model for this and that?" I turn it into a project, and then I get the support of the students as well. And yeah, so yeah, I think that's pretty much it. So yeah, they learn fundamentals of AI. It's not, I'm not sure if I'm allowed to use this word, but it's kind of like a conversion course. So if you're a biomedical scientist, not much coding experience, in the first semester, you'll be taught not just the informatics side, but also the coding as well. And then by the time you come to me, you'd know Python, you'd know R, and we can start showing you how to put these models together.
Thank you.
Cool. Yeah, I teach within the biomedical engineering, so the School of Engineering. In terms of my research, I'm also based in Derry, so the Digital Environment Research Institute. And for teaching, I teach on the neuromuscular bioelectricity biomechanics course. So there, and we try and bring in like the digital health side of analysing movement, so the biomechanics, and link that to different healthcare apps that are coming in, so that you'll see in terms of where you can go with digital health and where AI can be used together with traditional biomechanics. And I also teach on the analysis in medical imaging course. That's a new course in biomedical engineering this year. And as part of that, we have a coursework where you look at image segmentation in different softwares. And then in terms of the future areas for that, then that would be automating the segmentation using deep learning. And we do some MATLAB and Python too. So
Okay.
Thank you so much. So it is approaching the end of the hour. So I am going to have to jump in and start our goodbyes. But thank you so much to everyone who has attended the talk today. I hope you found it as fascinating as I did. Thank you for all your very engaged questions. We covered a lot of ground, I think, in a short time. And I'm sure we could all stay here for another hour. But unfortunately, we have to let you go. Thanks so much to Cameron and to our panel for taking the time to share their expertise and lead this discussion. If you enjoyed today's talk, we have 2 more coming up next week, both with Cameron. One is about AI ethics, and the other one is called Human-Led Innovation in AI. So that will be covering more robotics and kind of human-led work with these systems. So please do sign up for those if you're interested through our AI Hub, and this has been sent to you via email. So that is the end. Best wishes to everyone. I hope you enjoy the rest of your day and hope to see some of you next week at the other sessions. Bye.
Thank you. Nice meeting everyone.
bye. Thanks so much. Bye.
Hi again, awesome listener. That wraps up another deep dive of Cameron's Lab Dive In. Before you dive back into your day, see what I did there? Take a second to hit that subscribe button so you never miss an episode. Want a behind-the-scenes look? Bonus content? Or just some good old STEM fun? Follow me on my socials, Instagram, TikTok, and YouTube at Cameron's Lab. And remember, every episode is a new adventure, and we've got some thrilling dives lined up for you. Don't miss out. Until next time, stay curious and keep exploring.